to the newest episode of Endocrine Anomaly, where we solve mysterious endocrine disorders. Today, we'll see Johnny, a 34-year-old male police officer who's visiting our emergency room complaining of chest pain and headaches for the past 30 days. The episodes seem to last about an hour, with sometimes a few more than that, and eventually resolve. Vitals are taken, an EKG is performed, and a lab blood draw is completed. Let's go over some of Johnny's initial labs and tests. His EKG levels were normal and slightly elevated heart rate. His blood pressure was concerning. It was high at 150/90. His weight also slightly concerning, with a BMI showing overweight and close to obesity. Additionally, his glucose levels indicated he was pre-diabetic, with an A1C at 6.1%. Potassium levels were low, and calcium levels were normal. Hi, Johnny. I'm here as an endocrinologist, and my name is Amy, and I'd just like to talk to you a little bit about your symptoms.
So really, my wife made me come in. I was having some chest pain, but it's probably heartburn or something. Also, I've been having a few bad dreams here and there, but she keeps saying it's more than that. It's been a few months now, and I guess you could say it takes a toll on me. I'm always tired, and according to her, I've been acting a little different.
Yeah, I think chest pain can be concerning. Can you give me a little bit of a background about who you are, what you do, who you live with, all of those things?
So to answer your questions, I'll start off with the job. I have a stable job. I've been working as a police officer for the past 7 years. I have a healthy family, love my wife and kids. I take them actually every week to their soccer and basketball practice. And one of your questions, you asked how I feel about these events or outings. I never really thought about it as much. I don't really get to watch them as I tend to focus on what's kind of going on around the environment. Really I just put my kids into activities to prepare them physically for the world. For hobbies, I go fishing on Saturdays just to get out. I'm not sexually active. I don't really have a sex drive, but I guess it's true what they say about marriage, right? I have been eating more, and I seem to have also gained a lot of weight recently.
All right, thank you so much for all of those answers. I'm going to order a few more labs just to measure different hormone levels that you have, and then we'll be right back.
Doc was confused. Could this be a case of hypertension, hypothyroidism, Cushing's, Addison's disease? Let's take a look at some hormones related to the adrenal glands, like catecholamines and aldosterone. And while we're at it, how about cortisol, CRH, and ACTH levels?
Let's go over some of the hormone test results that Johnny presented with. So we see renin levels are slightly high. Testosterone is low. We see aldosterone levels also high. Could this be the result of the high blood pressure? We see DHEAS as normal. Most surprising, we see cortisol levels as very low. T3 and T4 are normal, indicating no problems with the thyroid. Catecholamines are elevated. We also see CRH as low and ACTH as low. CAR levels are elevated. Standouts are cortisol, ACTH, CAR, CRH, catecholamines, renin levels, and aldosterone levels.
There seems to be low cortisol, but high catecholamines. But how? Maybe this is a job for a different type of doctor. A psychiatrist.
After just 2 sessions with the psychiatrist has a strong reason to believe that Johnny has a case of delayed onset PTSD. That means he experienced something traumatic a long time ago and has since been experiencing symptoms, but hadn't realized they were associated to the initial traumatic event.
So, how did this happen? Well, when Johnny was a child, he was involved in a bad car accident with his parents. No one was hurt, but he was stuck inside the car for a couple of hours after the collision. Moving forward, he never really talked about it much, nor did he seek therapy. Nowadays, he can recall being a little bit more jumpy when he hears loud noises as opposed to his friends, and having sweaty palms when behind the wheel from time to time. Additionally, his career as a police officer and what he goes through on a day-to-day basis also added to his past trauma. Accumulating over time, this caused for more severe symptoms.
But the big question here is, how is this PTSD actually causing physiological distress for Johnny? The ER doctor might have been right in referring Johnny to an endocrinologist.
When it comes to the stress response, the HPA axis is the boss.
The HPA axis, or hypothalamic pituitary adrenal cortex, is the connection between the hypothalamus, the anterior pituitary, and the adrenal glands located on top of the kidney. CRH is secreted from the hypothalamus. ACTH then is created in the anterior pituitary glands. And cortisol is eventually created in the adrenal glands. This gets distributed into different tissues, including muscle tissue, the GI tract, the eyes, and sweat glands to produce a physiological effect. So let's talk about Johnny's symptoms and how they were related to PTSD and the endocrine system. First, we see extremely low levels of cortisol. But why would someone with PTSD have low levels of cortisol? That seems a little bit counterintuitive. Well, while it's still a bit unknown, researchers believe that after a traumatic event, you get a surge of cortisol thrown into your body. And this disrupts the negative feedback loop over a long period of time. You can think of this like overflowing water in a sink. The cortisol is the water. If the sink is full of water, you eventually will shut the faucet off. Then, even if the water is drained, you don't want to turn the water back on because you don't want it to overflow again. So this is like that negative feedback loop of cortisol. The body basically just shuts down production of cortisol after you have this high level of cortisol from the traumatic event. So why are we seeing high levels of catecholamine? Researchers believe that because catecholamines are so closely related to the nervous system, when the body experiences continuous triggers over time, the nervous system is sent into a fight or flight and activates the production of catecholamines, including epinephrine and norepinephrine. That's why we see high levels of catecholamines and low levels of cortisol. What about Johnny's weight gain? We think his weight gain was directly related and linked to excessive overeating as a result of a coping mechanism to do with his stress. Because Johnny was constantly feeling these levels of stress and not dealing with them, he would turn to food as a level of comfort. And herein lies the big question, his hypertension and his chest pain. But we believe that Johnny's blood pressure and chest pain was coming as a result of his elevated catecholamine levels. These high catecholamine levels were wreaking havoc on his adrenal glands in general. We saw high production of aldosterone, which is also leading to his elevated blood pressure. We also saw disruptions in the renin production, which can also disrupt high blood pressure. So all of this was coming from a mental space that just had not been addressed. So what were the treatments?
For now, the psychiatrist prescribed anti-anxiety medication and MDMA-guided therapy. For lifestyle changes, it was recommended for Johnny to be mindful of possible triggers and trying to avoid them. Also, reducing stress in any way possible, like meditation exercise, and having a well-balanced diet. Lastly, attending a weekly one-on-one session with a therapist to try and heal his past trauma. Moving forward, for follow-up, Johnny would go to his endocrinologist every 2 months, where they'd monitor his weight, blood pressure, cortisol levels, catecholamines, testosterone, aldosterone, and potassium levels. This, along with any change in mood or behavior, as well as any increase or decrease in symptoms that he was having before. It was also noted if Johnny reports any feelings of extreme depression or suicide, that he immediately contact his therapist or the emergency department.
To conclude, PTSD can cause traumatic effect on the normal physiological process of the human body. The reasons for physiological distress can go undiagnosed if providers do not look at the entire picture. This includes mental health. Johnny is an example of this. He went into the ER with symptoms that could indicate myocardial infarction, stroke, or other physical trauma. But ultimately, none of these were the diagnosis. It is important that healthcare providers include all of the possibilities prior to diagnosis. This will allow for the best treatment of patients. Welcome to an endocrinology.